I'm Cindy Gay. I'm an associate professor in the Division of Infectious Diseases, which is my specialty. Within the hospital at any one time where I'm in the inpatient setting, we, or my team, are seeing patients with any sort of infectious disease. So that can be helping the primary teams to diagnose, figure out if they have an infection at all, and then help them with treatment and sometimes follow up when they're out of the hospital in the outpatient setting. My approach to care is really to quickly figure out as much about the individual that's in front of me, where they are, sometimes what their health literacy is, what language I'm going to use, even sometimes sort of what personality I'm going to bring. I think that the building of trust with the patient is early on is really, really important. I think one of the things that I love about UNC is one, that it's a public hospital, it's a public university, but I do think that one, the sort of higher ups at UNC take our mission, which is to be a hospital for the entire state, quite seriously, and there are a number of examples of that. My research, really up until 2.5 years ago, it was all focused on HIV-related research, but that's been anything from some small scale program implementation to diagnosis and treatment. But then for about a little over the last decade, I sort of pivoted and started working with some of the basic scientists at UNC on some translational research around trying to get us closer to an HIV cure. So that's been quite a learning experience. Outside of work these days, it's mostly hanging out with my two kids. I have a 13-year-old and a 10-year-old, and just doing fun things with them. But I garden, I get on my road bike when I can, which is not nearly as often as I would like. Some unsuccessful attempts at other types of exercise. I guess a new thing that my husband sort of dragged me into was taking my sort of souped up Mini Cooper and driving it around a sort of semi racetrack faster than I've ever driven it before. That was fun.